I'll be going over the physical examination of the neck for this patient. So what I want to do first is basically look at his posture. I want to make sure that he has kind of an upward posture. His head is facing forward. It's not bending down too much. With this patient, as you can see, his head is a little bit forward, just in front of his shoulders. So that would be something we would want to correct. And also, with all the movements that we're going to be doing later, we want to make sure that the movements are smooth and there's no catching. So first I'm going to do a bony palpation, and let's see. With bony palpation, what I want to do, I want to look for crepitus, any point tenderness, or bony deformities. So Tevin, if you could just lie down, put your feet over there. A little limited with space, so I'm just going to
Do you want me to
take a knee right here. Yeah, so lie down and then have your neck off the edge. Okay. So what I'm going to start with, you can relax, I'm going to hold your head. So just relax all the way down. Yep. So I'm going to start by palpating the occiput, which is kind of the occipital bone right there. And then I'm going to go a little bit more inferiorly to the occiput. And then I should be able to find the anion, and that's that little bony protrusion right there. Then I'll find the mastoid process, which is right behind the ear. It's that bony spot right behind the ear. And then what I'm going to do is I'm going to look for his neck vertebrae, starting with the cervical vertebrae. And then I can find the spinous process by going straight down the middle, and it's going to be the most prominent protrusion on the vertebrae. And then by going laterally to the spinous process on each side, I'll find the transverse processes of each vertebrae. And then to find the facet joint for these vertebrae, I can find the spinous process of one vertebrae and then the one right below it. And then the facet joint is going to be right in between those spinous processes. Okay, you can set up now. Now moving on to muscle palpation. What I'm looking for here, I'm looking for localized heat, any pain, swelling, radiation, or loss of muscle function here. So I'm going to start with the sternocleidomastoid and then kind of work my way back. So sorry, my hands are a little bit cold, but sternocleidomastoid is going to be the most anterior of these neck muscles, so you can find it on both sides. And then you'll have the scalene muscles kind of directly behind them, and then the splenius muscles almost on the posterior lateral side. And then looking at the upper trapezius, the muscles are going to start right here, and then they're going to kind of make their way up towards the posterior side of the neck. And I didn't feel anything off with that. And then the last thing I'm going to look for is the ligamentum nuchae. So it's basically just right up the back of the vertebrae, right where I was palpating with the spinous processes and the transverse processes. Let me see. Okay. And then moving on to range of motion, if you could lie back down for me one more time, like we just were. Okay. So with this, what I want you to do first is I'm not going to assist you at all. I want you to do flexion, so bring your neck straight to your chest. Good. And then extension, so basically just let your neck drop off the edge of the bed. Okay. And then lateral flexion, so you're going to bring your chin to each side of your... I'm sorry, that would be a rotation. That's what he's doing right now. And then lateral flexion, you're going to bring your ear to your shoulder. Good. So now I'm going to passive range of motion. I just want to make sure that there's kind of like a soft tissue end feel. You can relax. Just let your head fall back. Okay. So I'm going to go up about 3 times. There's a normal end feel right there. And then here with extension, I'm kind of just going to let it drop, see how far it goes. Lateral flexion, making sure there's no tightness or little tightness right where the neck muscles are, and then bringing them into rotation here. And we're good. Okay. Finally, with resistive range of motion, what I'm going to do for flexion is I'm going to place my hand on his forehead, and you're going to push up against my hand, making sure that there's enough strength and that it stays smooth. And then you can push back against my hand for extension. Good. And then push against the side of my hand for lateral flexion. Good. And this way. And then with the rotation, I'm going to put my hand right here and then bring your chin to your neck, or your shoulder.